Hi, this is Dr. Kurt Woeller for the Candida Mastery Course. Title of this short video is Comparing of Organic Acids Test Markers linked to Candida and comparing that to IgG antibody testing. Now, this is an example of content that is found within the Candida Mastery Course. So one of the things we go through extensively is looking at markers on the organic acid test. Now, we'll profile Great Plains Laboratory, but once you learn how to interpret their markers, you can interpret other companies' organic acids as they relate to Candida and fungal problems. And then we'll also look at food sensitivity testing. So on page 1 of the Great Plains OAT, there's a lot of information looking at bacterial markers, Clostridium markers, but then specifically looking at yeast and fungal markers, giving us indicators of Aspergillus mold exposure, indicating gut colonization of mold, invasive Candida, and a number of other markers linked to yeast. So what happens is when Candida becomes invasive, it produces different enzymes. One of them is hyaluronidase. That breaks down hyaluronic acid, that intracellular cement, and we get a production of a chemical called arabinose because of that activity. Now, arabinose can create a number of its own issues. It can complex with lysine and interact with arginine, forming a chemical structure called pentosidine, which has its own toxicities, triggering autoimmune disorders, for example. We know that Candida can become invasive because it grows a hypha, a root structure, essentially right through the tight junctions of the epithelial cells. But through the production of an enzyme called invasin, it can also become invasive into the epithelial lining as well. And what ends up happening is that can trigger a lot of autoimmune reactions, create a situation of leaky gut. And anytime we start to damage the lining of the digestive system, we also compromise the production of secretory IgA, that main immune chemical necessary for immune function within the digestive system. So there are a number of tests that can be done. We talk about within the Candida Mastery course. One of them will be blood testing, looking at IgA, IgM, IgG antibodies. IgA is mostly produced in an abundant amount within the digestive system. We produce IgM and IgG throughout the body. IgM is the first antibody that's actually produced. IgG gives us that more long-term immune recognition. But it's possible to have IgG elevated, indicating systemic reactivity secondary to invasive Candida. So in all of us, when we come in contact with a pathogen, the first thing we're going to produce is IgM, and we will get some IgG that gets produced sometime thereafter. There's always the potential for a secondary response as well. And IgG, for example, can create a situation of inflammation, because what it will do is it engages a system called the complementary cascade, which helps drive inflammation. Now, IgG food sensitivity testing, a number of companies offer this type of lab, but Great Plains actually has a panel that includes not only IgG reactivity to food, but also to Candida. So if you look at a food IgG profile for most any lab, they're going to give you an elevated IgG representative of hypersensitivity to various foods. So we can see here dairy, we can see here wheat, for example. And this individual actually has high IgG reactivity that could trigger inflammation. Also, it could be linked to just long-standing gastrointestinal candidiasis, for example. Now, one of the things that Great Plains has actually done is looked at the levels of IgG being linked to low, moderate, or high levels of Candida. And so the higher the level, the greater the problem there is with regards to Candida, but also the greater production of IgG, which could also then correlate with increased immune reactivity, inflammation, etc. So in this particular individual, we've got a moderately high elevated level. Okay, there's many examples where these levels are extremely high. And then you can correlate that information with markers on page 1 of organic acid testing. So in this particular case, we've got a very high level of arabinose indicating invasive Candida. So we not only have mucosally invasive Candida linked to arabinose, we've got very high IgG reactivity linked to systemic immune reactions that is recognizing the invasive nature of Candida and then generating inflammatory reactions secondary to it. For more information about the Candida Mastery Course, visit candidamasterycourse.com. This is a very in-depth course with regards to Candida and other fungal-related problems, looking at lab testing, looking at clinical assessment, pathogenicity mechanisms, treatment options, etc. Again, I'm Dr. Kurt Woeller for the Candida Mastery Course. Thank you.